Hi, I'm Dr. Rahi Victory. I'm a reproductive endocrinology and fertility specialist, and we do short little videos to inform you about infertility and all things infertility. So today we thought we'd just talk about what happens or what to expect with your first fertility visit. So we're here to help you and support you through this process. We want you to be aware of what to expect so that we ease the stress and the tension that can come along with this journey. So during your first fertility consult, whether it's in person or now because of COVID-19, you're doing it virtually, either video or telephone, you can first expect that your physician should take a detailed history from you. What's included in that history? Well, we want to know your age, your demographics, how long you've been trying for, how your periods are. Are they regular or are they irregular? We want to know if they're painful, if sex is painful, if your periods are heavy. We then move on into things like how often you're having intercourse, both around the ovulation time and during the rest of the month. We also want to know about your past obstetrical history. Have you been pregnant before, or is this secondary infertility, or is it primary infertility? So we need to know, is this the first time you're trying to get pregnant, or have you previously had pregnancies, or have you had losses in the past as well? We need to know about your gynecologic history. Has there ever been any sexually transmitted infections? Have you ever had any gynecologic surgeries? And those can include things inside your pelvis, like your ovaries, your uterus, your fallopian tubes, or it can include things in the vagina, like your cervix for women that have had cervical dysplasia in the past. We then want to know about your general health. Are you medically healthy? Do you have thyroid condition, diabetes, arthritis, Crohn's disease, a whole list of things that could possibly be there. We need to know about your surgical history. What sort of surgeries have you done in the past? What's your family history like? Have you ever had a family history of chromosomal problems, genetic problems, birth defects? Your allergies, your general well-being. We need to know about your psychosocial history. Do you smoke? Do you drink? Are you using any street drugs? How often are you doing those things? How much are you using? And then finally, we need to know basics about you, your height, your weight, what's your physique like? What about your general review of your systems in terms of, is there acne, is there hair growth, is there hair loss? If you are struggling with weight or if you're not struggling with weight, and so on. Those are all the details about the ladies. For the guys, we need to know, has there ever been previous children as well? We need to know if you have any problems with previous history of trauma to your pelvis or surgeries, infections, exposures. We want to know about erectile function or dysfunction, your sex drive. We need to know if you've previously had a sperm test done before. We want to know about your general health. We need to know about your surgical history. We also need to know about your family history. Again, are there any chromosomal problems, birth defects, genetic issues that run through the family? And finally, we want to know if you're on any medications. And then, of course, the huge issue with a lot of our guys, are you smoking, are you drinking, are you using street drugs, all of which can be detrimental to your fertility journey. We want to know if you're on any medications for any chronic health conditions. And again, of course, if there's been major surgeries, in particular if they're pelvic surgeries, even if it was just a hernia, we need to know about those sorts of things because those can impact your fertility journey as well. Once we've ascertained all of that, we're going to talk to you about what infertility is and how it's diagnosed. And we'll go through the different aspects of infertility, the male factors and the female factors. We'll explain how each of them plays a role. We'll explain how it applies to you based on the information you've provided us. And then almost always, we're going to need to proceed with testing. That testing will be sort of global testing for both of you. We look at sexually transmitted disease screens. For the men, we need a semen analysis, and then sometimes we need more advanced analyses like sperm DNA fragmentation testing. For the women, you'll need ultrasounds to count the number of eggs, to see how your lining is developing, hormones to correlate those findings, generalized hormones, again, sexually transmitted disease screening. You'll need your vitamin D tested, you need your anti-Müllerian hormone level tested, and then on top of that, you need a special ultrasound called a saline infusion sonohystogram, where we're looking to make sure that the inside of your uterus is normal, your fallopian tubes are open, your cervix is open, and that the ovaries don't have any major cysts or lumps or bumps on them. All of that gets put together, we come up with sort of the answers that we need to figure out what's wrong, and then we organize our next call with you so that we can give you the answers you're looking for, tell you what's wrong, give you all of the options that are available to you, and then help you decide what you want to do. We're not going to tell you what to do. We never force anybody into anything. We recognize that fertility is a loss of control for many of our patients. We want you back in control. So we explain the process to you, explain what tests need to be done, help guide you through those tests, get you the answers you need, relay those back to you, lay out all of the options that are available to you, and then support you through your decision-making process. So that's basically what to expect at your first visit. Obviously, not all the tests are going to be done then. That's probably going to take you about a month, but that first visit is going to be your history, possibly a physical examination if you're in person. We're going to involve you with the information. We're going to relay it back to you, explain everything you need to know about infertility, and then we're going to prepare you for that testing. I hope that explains what needs to be done at that first visit, alleviates any concerns you might have. We don't poke and prod patients at our first visit almost ever unless there's a really clear-cut indication to do so. So it's a fully clothed visit with no stress, no anxiety. There is no pushing of anything. We're just going to find out from you what you guys have gone through so far, what is going on in your health history, and try and start the steps to getting you to where you want to be. Have a great day, and I hope you've enjoyed this video. Make sure you like, comment, and subscribe. Thanks.